when you look at approaches that can help sort of reorganize sensory systems, these can reorganize in a very similar fashion to the motor cortexes. So we know that it is possible that these systems can be reorganized. How do they do that?
Hey everyone, my name is Dr. Nick Halsey with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
I'm going to go back over to Kim really quickly. I don't know if Kim, if you're still here, let me know.
Yeah, I'm here, and I remembered a question. I did talk.
Okay.
The person I spoke with earlier on the phone was Matt, by the way, and he was really helpful. And he and I talked about this, but maybe you could address it too. And
Sure.
I mean, I have a feeling the answer might be just, it depends on a lot of things, and it depends on the individual. But one of the testimonials I read on the website, somebody had been using the hand apparatus, and then noticed that some feeling was coming back in their fingers. And so I was just wondering, I don't know, can you speak to that? Like, can doing these reps maybe improve some of the sensory deficits or weirdness? I mean, I have weird stuff going on both sides now. And one of, the problems is like with carrying things in my affected hand is I can't feel that it's in my hand.
Sure. So I think this is a good one. Now, let me quickly, as I always do, I will go back to the evidence and then I'll march forward, usually with first principles. So the unfortunate answer is, with respect to the Motus hand, Motus foot, and actually most of these sort of high intensity rehabilitation programs like constraint therapy, these sorts of things, haven't really done formalized evaluations of changes in sensation specifically. That's an unfortunate consequence. I think mainly because the primary outcome that's monitored is function. I use quotes there intentionally because for me, function is the sort of combination of sensory motor capabilities in addition to your perceptions. And so that being said, when you look at approaches that can help sort of reorganize sensory systems, and there are very, very good preclinical studies on this and some very, very good early work in humans. And these were actually some of the beautiful, beautiful work by Randolph Nudo in the late 90s. And these studies show that following lesions to the certain cortical structures that actually cause sensory deficits, your sensory cortex, your parietal systems, these can reorganize in a very similar fashion to the motor cortexes. Okay, so we know that it is possible that these systems can be reorganized. How do they do that? Well, they actually did repetitive task practice, which is funny. And what needs to happen is, in these cases, very much like the motor systems need to be driven to cause positive changes to occur.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro-rehab.
Task practice, which is funny. And what needs to happen is, in these cases, very much like the motor systems need to be driven to cause positive changes to occur. You have to do the same thing with the sensory systems. You have to be exposed to a variety of sensory stimuli, and those systems will then try to reorganize. Now, there are some constraints to this, and that is if the damage is too sort of, let's say, large in these systems in the cortical structures, it's not like areas of your motor cortex will start to take over the sensory cortexes, right? And so provided there is enough residual sort of sensory systems there, then you can start to get some carryover effects. I'd say in the other extreme case, it's less likely if there is, let's say, very, very extensive damage and there is absence of sensation. I'd say it's much more likely to have reorganization happen when you have residual sensations and they are being interpreted poorly or incorrectly. Maybe not poorly is a wrong word. Maybe interpreted incorrectly. And what I mean by that, the sort of classic example here is pain. And so what happens after a stroke or traumatic brain injury, oftentimes the sensations are misinterpreted. Hypersensitivity to hot, cold, pressure, these sorts of things, they cause pain. And that's not because, evolutionarily speaking, pain is a very, very powerful stimuli to keep us from hurting ourselves. But in these cases, following a neurologic injury, the sensations that normally would just tell, hey, my skin is being sort of lifted or moved, cause my brain to infer pain, right? Pain is not in our hand. Pain is all interpreted in our brains. Technically in our spinal cords, then is inferred in our brains, but that's a story for another day. Being able to rewire those systems, try to reinterpret them, I'd say there's better evidence for that. And in those cases, what you need to do is basically need to do sensitization training, where you're kind of going through the motions and trying to reorient things to them not being painful, trying to normalize those types of sensations. So I say that's kind of the range of things that can happen. I'd say if you have residual sensations and they are maybe different than normal, whether that's good, bad, or ugly, it's usually a better predictor than someone who has absent sensation and is trying to build back anything. Not to say that it doesn't happen, and that can happen. And in fact, some of those early studies in those there were more focal lesions in these studies, meaning focal being small lesions, but they were small but dense lesions, meaning there was no probability of the actual area taking over again. They actually found that in the cases of the hand, it actually was expanding into the residual sensory cortex. So that is certainly possible, but it is quite hard to do, and does take a lot of repetitions to actually drive those changes. But it is possible, though. Hopefully that gives you kind of a sense of the scope of the possibilities. It's of course very, very complex, but hopefully I was able to give you at least a broad overview.
Yeah, thank you. Thank you very much.
Yeah, of course.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.